She's here to answer the questions you might not feel comfortable asking your own gynecologist. Dr. Barbara Schroeder is here to help women better understand some of the health issues that we face. Thanks for coming in today. Now, before we get started, why do you think so many women have a hard time asking the pertinent questions to you face to face?
You know, I think that a lot of it depends on some patients feel time pressure. Some patients, it takes them a while to get comfortable with their physician to kind of get
There's
a
little
good
bit of
feel.
embarrassment too, I think, involved in that.
And a lot in our subspecialty, there are a lot of things that are very sensitive topics, and it's hard for some patients to talk about those things with their doctor.
Well, we have gotten lots of emails, and we're going to start off with the first one right now. This person writes, I am diabetic and constantly get yeast infections. Why is this, and what can I take or to do to prevent this or slow this down?
Well, with diabetes, you have sort of an immunosuppressed state. Your immune system is somewhat suppressed, and really the most common reason why diabetic women get recurrent yeast infections is because their blood sugar is not as well controlled. So really the best thing that women can do, or men also that get repeated yeast infections, is to really try to keep their blood sugar under the best control possible, and that will already eliminate a significant number of these
What about
problems.
a woman who is not a diabetic who might have the same problem?
Well, women that are not diabetic, just good hygiene, and for example, we get this a lot in women that work out. They keep their workout clothes on, it's moist in that environment, they're sweaty, and just by coming home, getting a shower, cleaning up, and putting on you know, dry clothes will definitely help.
Sure. Number two, what causes an abnormal pap smear and how can it be prevented?
There's a number of different reasons. Sometimes just inflammatory or infectious processes, vaginal infections can cause abnormal pap smears in menopausal women. Just because of the lack of estrogen to the vaginal tissue, there can be cells that look abnormal that really aren't, but just because of the lack of estrogen, it appears that way. But really the most common reason is the human papillomavirus. Preventative agents, really for infections, just taking care of the infection will oftentimes help, so oftentimes we'll treat patients, have them come back for a pap smear, and that resolves. For menopausal women, just using topical estrogen cream to the vaginal area will help eliminate that problem. For HPV, really...
and HPV is a sexually transmitted disease, so would you say, hey, cut back on the number of sexual partners, or, you know, don't have sex at a young age?
Right, that's exactly right. That we know that the highest risk group is women under 25, and the more sexual partners you have in your lifetime, the higher risk you have of being exposed to this. So really, abstinence is really the only way to 100% prevent that, or just staying in a long-term, mutually monogamous relationship is the best way to prevent that.
And does smoking exacerbate the situation?
Yes, it certainly does. We know that smoking is one of the risk factors for cervical cancer and also for the HPV.
Very interesting. All right, this next email. I've been thinking about storing the stem cells from my baby's cord blood. However, I have gotten different opinions from my pediatrician and my OBGYN on the value of doing this. Do you think it's important to save it?
You know, I definitely think it's important for us to talk to patients about it. There are certain states in the United States, about 8 or 10 states, that now have made it mandatory for OB-GYNs to discuss this. I think there are some valuable resource. That is a valuable resource. I think it's something that patients should think about, not only for current treatments, but also for regenerative medicines in the future. Currently, there's about 80 diseases that can be treated with cord stem cells, not just cancers, but also metabolic diseases and blood disorders. And I think the most exciting arena comes in the regenerative medicine
is it expensive
field.
To do this?
It is. The initial cost is somewhere between $1,500 and $2,000. Then after that, it's about, on average, $120 a month. So, I mean, $120 a year, excuse me. But most of the companies do have payment plans, so even those patients that can't afford a big lump sum at the beginning, they can pay monthly installments, and they have different ways that they can
afford that. Okay. This next person writes, I've been trying to get pregnant and I have not been able to. I recently found out that I have a cyst on my ovaries. Does this have anything to do with it?
It's possible that it could. Most of the cysts are physiologic cysts, and those probably would not contribute significantly, but there are endometriomas and other cysts that could potentially prevent ovulation from that side. So it is definitely something to be followed up. If patients have been trying for close to a year, depending on their age, to get pregnant and have not been successful, I definitely recommend that they go see an infertility specialist. If they're younger and it's been less than a year, it definitely warrants going to see their OB-GYN, going ahead and talking about some of the initial workup and what they're willing to undergo at this point in time, kind of get a game plan and a time frame for what to do, and then follow that.
Yeah, because there's so many options these days for getting pregnant and whatnot, so always go see your doctor. That's the most important thing. Go get a yearly examination and pap smear. It can prevent so much
Exactly. While we're on the topic
future.
of one of the questions here about the PAPs or the abnormal pap smears is that really, you know, we have a lot of talk now about the HPV, about the vaccine. Really, the vaccine is an adjunct, but you still need to go and get your pap smears every year.
Right,
that's
prevention.
Exactly right.
The best medicine, prevention.
That's exactly right.
If you have a question for the doctor, all you have to do is email us at askthedoctor@fox26.com. You can also log on to our website, myfoxhouston.com, and click on Morning News. Thanks so much for coming in. We appreciate it. Jose.